On March 31, 2023, Centers for Medicare/Medicaid Services announced the gradual transition to V28 of the CMS-HCC model. Phased in over time, the plan is to switch completely to the updated model by 2025. This change has widespread implications and all health plans should already be thinking about this transition. In this video, we'll explore how the new model will impact your risk adjustment program, why transitioning now to the blended model is a good idea, and how you can make this transition as seamless as possible. Transitioning from version 24, V24, to version 28, V28, includes significant changes to HCC codes, disease mappings, and impacts on RAF scores. Organizations have some good news as a blended percentage will be used for the 2023 data collection year. Percentages will include a blend of 33% for the V28 model and 67% for the prior V24 model. Further, V28 will be deployed at 67% in 2024 and fully phased in at 100% in 2025 diagnosis collection years. Now is the time to review documentation to achieve accurate code assignments. In 2023, MA plans are paid on the 2020 version, V24. CMS proposed changing to V28 starting January 2024 but compromised of phasing in V28 over 3 years. In the 2024 V28 CMS-HCC risk adjustment model, CMS has made changes by including reliable predictors of future costs and excluding unreliable ones. In summary, the payment year 2024 V28 CMS-HCC model classifies the 74,000 ICD-10-CM diagnoses codes into 266 CMS-HCCs, 115 of which are included in the 2024 payment model. This increase in condition categories from the 2020 CMS-HCC model, 86 in payment, is due to the greater level of detail within ICD-10-CM diagnosis codes. In aggregate, the 2024 model contains approximately 20% fewer ICD-10-CM codes than the 2020 model, resulting from the removal of diagnoses per CMS risk adjustment principles. Below are some important updates made to different categories within the risk adjustment model for the 2024 CMS-HCC model that will affect coders. How has the diabetes disease group changed in the 2024 CMS-HCC model? In the 2024 CMS-HCC model, the diabetes disease group in the V28 has 4 payment HCCs, including HCC 35 added at the top of the hierarchy. Overall, diabetes without complications, going up, diabetes with complications, going down significantly. How has the metabolic disease group changed in the 2024 CMS-HCC model? In the 2024 CMS-HCC model, the metabolic disease group expanded to 4 payment HCCs from 3 in the 2020 model. High-cost lysosomal storage disorders were split into a new HCC, 49, and metabolic and endocrine disorders were separated into HCCs 50 and 51 based on cost and clinical considerations. Other conditions with lower cost implications or indicating lab test results were mapped to non-payment HCCs. How has the blood disease group changed in the 2024 CMS-HCC model? In the 2024 CMS-HCC model, the blood disease group expanded to 7 payment HCCs from 3 in the 2020 model. Coagulation defects, hemorrhagic conditions, and purpura are mapped to payment HCC 112 or non-payment HCC based on clinical severity and specificity. Immune conditions are split into HCCs 114 and 115, with costlier and clinically severe conditions in HCC 114 and other specified disorders in HCC 115. What updates have been made to the heart disease group in the 2024 CMS-HCC model? The heart disease group in the 2024 CMS-HCC model expanded to 10 payment HCCs from 5 in the 2020 model. HCC 85 congestive heart failure was split into 5 payment heart failure HCCs, 222 to 226, based on clinical severity and cost differences. HCC 221, Heart transplant status/complications, was added to the hierarchy, and HCC 227, cardiomyopathy/myocarditis, was split out as a separate HCC. What are the key updates in the 2024 CMS-HCC model for vascular diseases? The 2024 CMS-HCC model introduces three new HCCs, 263, 264, and 267, by reconfiguring HCCs 107 to 108. The updated model focuses on more severe cases of atherosclerosis of arteries of extremities, while less severe manifestations are mapped to lower-level HCCs. All mental health codes under V24 HCC, 55 and 59, will no longer carry a risk adjustment score weight. These are just a few examples of how the migration from V24 to V28 will play a major role in how we receive reimbursement for mental health codes. 120. Alcohol abuse with intoxication, uncomplicated in CMS-HCC V24 maps to HCC category 55 with a risk adjustment factor of 0.329. In CMS-HCC V28, it will now map to no HCC, carry no risk adjustment factor. 70. Bipolar disorder, currently in remission, most recent episode unspecified currently maps to HCC category 59 with a risk adjustment factor of 0.309. In V28 model, it will no longer map to an HCC, carry no risk adjustment factor. Some changes were made in Medicare Informatics Risk Adjustment Risk Score Calculator. As of January 1, 2024, the default risk adjustment model was updated to Payment Year 2024 CMS-HCC V28. Blended, V24 and V28, Risk Adjustment Score PDF is generated by clicking the Blended Risk Score PDF button. One instance of V24 Risk Adjustment Score based on disease coefficients in a community, non-dual, aged 74-year-old male beneficiary with multiple chronic conditions. One instance of V28 Risk Adjustment Score based on disease coefficients in a community, non-dual, aged 74-year-old male beneficiary with multiple chronic conditions. Including a diagnosis that newly maps to a payment CMS-HCC in V28, alcoholic hepatitis without ascites, K70.10. A large number of relatively common conditions will not map to a payment HCC in V28. Significant negative impact on risk score based on disease coefficients in a community, non-dual, aged 74-year-old male beneficiary with multiple chronic conditions. Including a diagnosis that newly maps to a payment CMS-HCC in V28, alcoholic hepatitis without ascites, K70.10. A large number of relatively common conditions will not map to a payment HCC in V28, indicating that RAF scores will decrease for many beneficiaries. CMS's use of constraining, where related HCCs like those for diabetes have the same coefficients, are also likely to impact RAF scores for a large percentage of patients. Blend Payment Year 2024 risk scores using 67% of the risk scores under the V24 Risk Adjustment Model and 33% of the risk scores under the V28 Risk Adjustment Model. This is an example of how V24 Risk Adjustment Score is calculated in the Blended Risk Adjustment Score PDF. This is an example of how V28 Risk Adjustment Score is calculated in the Blended Risk Adjustment Score PDF. Blend Payment Year 2024 risk scores using 67% of the risk scores under the V24 Risk Adjustment Model and 33% of the risk scores under the V28 Risk Adjustment Model. Medicare Informatics Risk Adjustment Score Calculator web application supports both HCC V24 and HCC V28, crucial to ensuring a smooth transition from V24 to V28. Please contact us if you would like to implement the risk adjustment score calculation in your environment.